Consequences are always a motivating factor for your patients. And it's so powerful that Dr. Owen says if you want to have a maintenance wellness primary practice, then you never stop talking about consequences. Hey everyone, great to be back with you with another important video that will impact you positively, provided you use the information. Today we're going to talk about the 6 C's. I'm not going to cover each of those separately or go into a lot of depth with each of those. Why? Because there are many training resources available to you for those 6 C's. Today we're going to talk about what they are, how to implement them, and then really hit on one of those 6 C's, which is going to be critical for you guys looking for a maintenance, wellness, long-term type of relationship practice with your patients. So let's get to it. 6 C's very quickly go like this in order. You have complaint, then you have comparative treatment, you have comparative costs, you have the care that you provide, the outline of that care, you have the consequences of their future without that care, and then you have the commitment. And remember, nothing gets done until a commitment is made. Some of you are a little bit nervous, a little bit anxious about asking directly for that commitment from the patients. Whoa. You be careful about that. If you don't have that commitment, you will not get compliance. You will not get the results that patient needs. Today, we're going to talk about those consequences. Consequences. We understand the power of consequences in the consultation with the need behind the need. We understand the fear of the future in the first report. Consequences are always a motivating factor for your patients. And it's so powerful that Dr. Owen says if you want to have a maintenance wellness primary practice, then you never stop talking about consequences. So how would you do this? You want to talk about consequences really in 2 ways. What did we do for you? What were the consequences of your situation when you came to us initially? That's an emotional process for your patients, and that really helps them re-energize and see the value of this care because of what happened to them positively because of the care that they're getting from you. And then secondly, of course, is what are we saving you from? And this goes into your philosophy. This goes into so much of what we teach and drip into those patients about our paradigm of healthcare. This goes into your 5-point office visit. If you're getting into maintenance and wellness patient visits and you find that you are not talking about, hey, remember what we did for you way back then? What were you dealing with? What was your life like? What were you concerned about? If you're not having those conversations, and if you're not talking about, boy, I'm glad we got this one adjusted. We sure saved you from X, Y, and Z. You're preventing X, Y, and Z from happening because of this maintenance, Mrs. Jones. If you're not having those conversations, you are missing the boat. Missing the boat when it comes to what motivates and helps that patient stay with care, see the value in your care, appreciate your care, and be excited about the care that they're getting from you. Okay, so very quickly, just make sure you know where those resources are for 6 C's. They are all in our training resources and material. And make sure you know that you can't use these as a checklist. These are themes in your office. Love to take one of these per day and make it a focal point. But specifically, if you're looking for that maintenance and wellness-based practice, that long-term type of relationship, the consequences and how you discuss those are absolutely critical to what you hope to accomplish with that patient. Best wishes, and we'll see you next time.